Hello, my name is Jennifer Monaco. I am a radiologic technologist at Johns Hopkins Hospital. To shield or not to shield? That is the new question for all those working in radiology right now. Radiologic technologists have the professional responsibility to perform radiation safety for the benefit of their patients. The use of shielding was first introduced in 1976. It has been ingrained into technologists that the shielding of the reproductive organs is mandatory for any and all patients who are within reproductive years. The effects of ionizing radiation have been known since the early 1900s. When ionizing radiation, such as X-ray, passes through the body, it can cause injury or mutation to existing cells, which could cause the cells to work abnormally or to lose function. The germ cells, or reproductive cells, are known to be the most sensitive cells in the body. Shielding of these sensitive areas are done to reduce hereditary risks of those individuals in reproductive years. ALERA, or as low as reasonably achievable, is a concept of radiologic practice. The purpose is to keep radiation exposure and overall dose to the lowest possible level. The American Association of Physicists have new recommendations for shielding practices. Policy change is going to happen whether the technologists are ready for it or not. The new recommendations are being made due to new information coming that shielding of the patient is no longer giving benefit to them, rather it may be causing more harm than good. The technological equipment being used today has lessened the exposure dose drastically. The equipment is more efficient, therefore the scatter radiation being caused is actually coming from within the body after the exam, not from leakage from the X-ray tube. The shield can obscure anatomy of interest during the exam as well, requiring the image to be repeated. If a repeat is performed, the use of the shield is causing additional radiation exposure to the patient. All modern imaging equipment uses automatic exposure control, or AEC, which causes the equipment to produce the exact amount of X-ray photons that is needed to penetrate the anatomy being imaged. When the shield is within the light field during imaging, the AEC will produce more X-ray photons than is needed because the equipment thinks that it will need more to penetrate the thick lead shielding. Who will be affected by these changes? The technologists, the staff, and the patients. Everyone will need to be educated on the reason for the new recommendations. The innovation development process. First, investigation. The current policy regarding shielding is that all patients should have their reproductive organs shielded during all radiologic exams if it does not obscure pertinent anatomy. Newer technologists take shielding very seriously, although older technologists are more lenient or no longer buy into the importance of shielding. Some technologists are set in their ways and do not follow policies just simply because they don't want to. Suggestions moving forward. Health organizations should come up with new policies regarding shielding that will need to be written and signed by all technologists. Understanding and compliance by the technologist of the new policy is crucial to the success of the change. To prevent a patient from getting upset about not being shielded during imaging, they will need to be made aware of the change. According to the Code of Ethics set by the American Registry of Radiologic Technologists, the radiologic technologist practices technology founded upon theoretical knowledge and concepts, uses equipment and accessories consistent with the purposes for which they were designed, and employs procedures and techniques appropriately. Medicine is constantly changing. It is our job as health professionals to be open and accepting when changes are made. The goal of this policy change is to remain up to date with patient safety practices recommended by professionals in the field of radiography. Radiographic imaging is an extremely important element in medicine. Although there is always a balance between the benefit of having the exam done and the risk of radiation exposure. What kind of organization and technologist would you want to go to in order to receive imaging? How would you want your loved ones cared for when they have recently fractured their arm or leg? What questions would you want answered when you witnessed your child not being shielded for their x-ray exam? These are the questions that all radiologic technologists should be asking themselves each and every day. They should be emulating how they would want themselves or their loved ones cared for. Proper education and detailed reading material about the policy change will help with the smoothness of the new implementation. Educating technologists thoroughly about the policy changes regarding shielding will ensure understanding and compliance of the change. This will also allow them to answer a patient's questions if and when they ask about the change. Framework for innovation. By not shielding reproductive organs, quality, cost, safety, efficiency, and outcomes are all affected. Quality. When using AEC, if the shield is in the light field of the exam, the computer will fix the image even if the image is overexposed due to the unnecessary additional photons. This does not give an accurate depiction of the anatomy being imaged. The shield should either not be used or a designated technique will need to be used instead of AEC. Costs. If the organization no longer needs to repeat images due to shields obscuring anatomy, the overall spending in the department will decrease. Also, constant use of the lead shields causes them to rip or break down due to cleaning. If the shields are not being used as often, the department will not need to replace them as often, which will affect costs. Safety. The biggest concern for all healthcare workers is the safety of their patients. The new recommendations are specifically to improve the safety practices for all patients receiving radiologic services. Efficiency. Time. Not using shields, as well as lessening repeats, will speed up exam times. This will enable the department to image more patients during a given time. Outcomes. Not using patient shields will decrease costs and increase productivity within the department. Implementation resources. Educating the staff, not just technologists, about the new recommendations and the policy change is key to the success of the proposed changes. Signage. A large portion of patients being imaged have come through the waiting room. This is an effective spot to have signage explaining the new recommendations from the American Association of Physicists and the policy change. Having a visual aid, such as pamphlets, to have on hand will give the physicians, staff, and technologists a quick and easy reference guide if and when questions arise. This could even be handed out when imaging is ordered to help the patient understand the changes prior to getting to the department. I would like to thank Dr. Ryan for making my first class towards my master's degree a success. I know that I have bad procrastination habits that I still need to work on. I really do enjoy the learning process and the work. Thank you for your understanding and for being such a great instructor.